Dr. Botel, we can go ahead and get started.
Okay. Thank you. I have to call to order the COVID-19 public briefing for the City Council of Riviera Beach. It is Thursday, and the time is 6:30. August 6th. Thank you. Madam Clerk, please call the roll.
Mayor Ronnie Felder. Chairperson Julia Botel.
Here.
Chair Pro Tem Douglas Lawson. Councilperson Trodrick McCoy. Councilperson Shirley Lanier. Councilperson Kashamba Miller Anderson.
Present.
City Manager Jonathan Evans.
Present.
City Clerk Claudia Anthony is present. City Attorney Don Wynn.
Here.
And over to you, Ms. Noel.
Thank you. Good evening, everyone, to another community teleconference on updates regarding COVID-19, city operations, and really anything that's vital for you to know this evening. We do have members of our city council here joining us to also receive the information. Before we begin, I kindly ask that anyone that is listening in or watching through YouTube, TV18, Facebook, to please share and let others know about this call right now so they too can also join in. As we normally do, we're going to start off with staff reports. You're going to hear from members of our Emergency Operations Center, and then afterwards we'll open it up for any questions, comments, or final remarks from our elected officials. So without further ado, we will have the city manager, Mr. Jonathan Evans, begin.
Thank you, Ms. Noel, and good evening, Madam Chair and members of the City Council and members of the Riviera Beach community. The City of Riviera Beach has continued to combat this virus since the emergency declaration that was executed on March 20th, 2020. We have seen the numbers in our state grow exponentially, but there is some positive things that Chief Curd will get into later on the call to show that there is signs of improvements. But again, as we've communicated in multiple situations and circumstances, that we must not become complacent or complicit. This is not over. This is not a virus that we deal with 9 to 5, and this is not something that we should take lightly. The City of Riviera Beach is looking to safely return its employee population back to work, and so I have released policies for employee review this evening. Those policies and guidance speak on a couple of items that I will articulate here. First, our return to work policy, the policy that will look to bring individuals safely back to work to ensure that we are always following the guidance and recommendations that are provided by the Center for Disease Control and Prevention, as well as information that has been provided to us by epidemiologists, scientists, and health professionals. When this policy was crafted, it was crafted with multiple individuals from multiple disciplines and multiple departments. This policy looks to make sure that services are being rendered to the public here in the City of Riviera Beach, but we also make sure that our employees, which are the city's most valuable resource, is protected. Also, we talk about reducing employees' risk to exposure, what they can do to effectively combat the virus. We know that the virus is in our organization and it's in every particular place that we may visit. We cannot think that just because our numbers are maybe 11 or 1,200 in our municipal boundaries that we have no opportunity of contracting this virus. And so we're looking at the situation as if any and everyone that we come into contact with could potentially be a risk for an employee or a member of the public and could have the virus as communicated. Most of the individuals that will contract this virus will be asymptomatic. So when we're looking at continuity of government, how do we continue to provide services? What is safe places for us to be? That is why we have continued and will continue having our elected officials meet in a remote setting versus a face-to-face meeting. This is for the abundance of caution and continuity of government. In the event that any of our elected leadership falls ill, and if a majority of our elected leadership falls ill, then we have to come to a screeching halt with regards to our ability to keep our community functioning. And so it is critical that we've taken the measures that we have taken to protect those that are in critical positions and our employees, to reduce the potential chance for exposure, and that we can continue to provide services throughout the duration of this pandemic. Also, you add hurricane season, it's the same individuals, it's the same team, it's the same group. Other agencies twice our size have individuals that they can rotate into multiple positions. They have the A and the B or the C team. We don't have that luxury. The individuals that are combating COVID, your employees are the same individuals that would have to be deployed to assist in hurricane response and disaster mitigation efforts prior to a potential threat. We've also provided workplace guidance, what we're looking for employees to know and what the expectations are. We want to be clear, we want to be concise, and we want to be direct with regards to our employees, because we're not just talking about them in their respective job, but looking at how they play a significant role in the organization in totality. So we're providing them guidance. We've also modified a workplace questionnaire that in the event that they're exposed or they may have contacted someone, been in contact with someone that's exposed, what are the questions that will be asked to screen? All our employees are screened prior to entering a city facility. Any individual that conducts business or visits a city facility is supposed to be screened as well. This will continue until we have a better handle on how we can treat, prevent, and address this virus. So that is something that we do not see sunsetting in the foreseeable future. We have also put in COVID-19 testing procedures. Right now, we are fortunate and still have been fortunate to have a relationship with American Care, but Chief Curd and Chief McCarthy have done some work, and we're looking at other options and alternatives as it relates to employee testing. One of the things that is facilitating us moving to another testing provider is American Care, the great partner that they are, really focus on the Medicaid, Medicare population, and they have been doing this to help the city in its time of need. So we are certainly grateful for that relationship. So we are looking to move to another testing operation. The staff has done some exceptional work with regards to finding some options, whether it's MD Now, whether it's CVS or Walgreens and other facilities. We have gotten some preliminary information that seems to be very competitive from a local lab that will be able to provide test results within 24 to 48 hours, more so on the 48-hour side, but they are guaranteeing that 48 hours because they will be the ones administering the test and then analyzing the data. So there is no shipping test results off to another lab. They are a one-stop shop, for lack of better terms. So we expect that that will help us, because what we want to do is make sure that if individuals are feeling ill and they do go for testing, and if they test positive, then they can be put on medication and then start the treatment process based on the information that staff has reviewed, that prophylactic care as well as hydrochloroquine and remdesivir, the faster those medications are utilized within the first 72 hours of a positive result, you're seeing the mortality rate go down exponentially. And Chief Kerr will talk a little bit about the mortality rate. We have communicated to employees the importance of doing things to boost their immune system. Like I stated, vitamin C, vitamin D, and zinc are being given as prophylactics, especially in individuals that are under the care of a physician. So we are encouraging employees that to utilize good judgment, but anything that can boost their immune system, especially in this particular time, is a good thing. We know that flu season is coming upon us. That is some concerning facts that we have to deal with as an organization, but we have already started the workplace plan, which looks to look at our existing facilities and what can be repurposed and what facilities or operations can be moved into other facilities to accommodate the social distancing, but still allow for us to provide service. So we have been successful, and thank you to the elected leadership for their understanding of how we are combating this pandemic. They have appropriated monies to facilitate workspace, cubicle farms, for us to build out cubicle farms to protect our employees, additional computing devices that we can offer a remote option when feasible, as well as additional sanitation throughout our city facilities to make sure that our employees are safe. And so it was a priority by this elected body to act swiftly and to provide the appropriate financial resources so your government can still remain operational throughout the duration of this event. We have also moved to Alpha Bravo. That will start effective August 10th. Alpha Bravo shifts is that we are looking at our continuity of government plan to make sure that we have the depth in the agency to be able to provide service. Right now, for instance, your utility operators, since the onset of this pandemic, have been working altered shifts. So they've been working 3 days, they've been off 2 days, and that is to ensure that we still have the capacity to be able to provide services to our residents, and that if any one particular individual on that shift gets sick, that there is an opportunity for individuals to backfill those positions so we can continue and there is not a lapse in service. Because at the end of the day, our core function is to protect the health, safety, and welfare of the public and our employees. And so we wanted to make sure that going to this Alpha Bravo complement allows for us to ensure that we can provide service through and through. And that's something that we are going to continue to do and monitor on a regular basis. HR has now assumed the responsibility of tracking employees that go for testing. They are provided with information to go to the testing center. Once an individual does test positive, they are called every day by the employer. In the event that we call and an employee does not pick up, we are going to their home, and we've made that clear to the employees. The call is predicated on us making sure that they're taking their temperatures twice a day, that they're feeling well, if there's anything that we can do, just checking in on them. In the event we don't hear from them, like I said, we will visit their place of residence because we want to make sure that our employees have that support, whether they're at home with their family or they're living by themselves, that they know that they have their colleagues and peers here to assist them. One of the things that is certainly important, I think it's so critical for us to really realize this, is that as I drive around in this community, and as many of us drive around this community, we see individuals time and time again that are not wearing the appropriate face coverings. We see individuals that are not listening to the guidance and direction that's been provided by this agency, but also the county and the state. This is not something to play around with. This virus is deadly. This virus has impacted individuals from age 9 to 99. We cannot allow for our community to be ravaged by this virus by not taking the safety protocols and procedures. So if you see individuals congregating or you see folks that are not adhering to the rules, certainly give us a call. We'll visit those stores. We'll visit those convenience stores. If we have masks, and law enforcement has been tasked with assisting if they see people that are not wearing masks, to provide them with masks. That is so important. Had we implemented a mask program on the onset of this virus on a state and national level, we would probably be in a profoundly different place. If we believed in social distancing at the onset of this pandemic, we'd be in a different place. So we have to continue to keep the consistent reinforcement of information. Law enforcement has been given the authority and will be and has already issued citations for individuals not complying with the mass emergency order. In the event that we don't continue to move in a direction that's positive, we will see the government entities starting to retrench and take away some of the things that were taken away on the onset of this pandemic. Our numbers are over 500,000, and we have surpassed New York, which was the epicenter. Now it is focused square on the state of Florida, and I think in our community, a community as diverse as ours, we know that the virus has adversely impacted communities that are very diverse, and so any and everything that we can do to assist and facilitate your city is here. We're here to help with testing, masks, food distribution, and you'll hear that from the other members of the team talking about services that are available and how the city of Riviera Beach can assist. And I want to thank everyone for taking the time to listen to my introductory remarks, and that concludes my comments. Ms. Noel, I turn the call back over to you.
Thank you, Mr. Evans. Next, we're going to hear from our Operations Section Chief, Chief Kurd.
Good afternoon, Council. John Kurd, Interim Fire Chief, serving as your Operations Section Chief. As always, I want to start off with some of the data that's come out from the Florida Department of Health. And as of this moment, the total number of cases in the state of Florida are 510,389. We have also seen in the state of Florida 7,765 deaths. In Palm Beach County, there have been a total of 35,737 cases, with 892 deaths reported in our county as a result of COVID-19. In zip code 33404, we see the total number of cases at 1,013, and we are starting to see what is a bit of a downward trend. Now, when I go through these numbers and we talk about some of the downward trends and we talk about some of the improvement that we're seeing, it's been so bad that this improvement is still not good, but it is better. It does show we are trending in the right direction. Some of these emergency orders, some of the guidance by the CDC seems to be helping with the numbers and the way they are trending. One of the important numbers that we need to look at revolves around testing and positivity rates. In totality, since the onset of the pandemic, Florida sits at a 13.21% positivity rate. That is the total positivity rate since mid-February. Palm Beach County is at 13.13%, so on average for the state in total positivity rates. The more important number that we want to look at, because we really don't want to tie in February, March, April, and May's numbers with what's going on today, is the daily positivity rate. That really gives us a better indicator of what the virus is currently doing in our county, in our community. Right now, the state of Florida's daily positivity rate percentage is at 9%. And Palm Beach County is at 9.9%. These numbers have been coming down. They now are just below the threshold of 10%. However, we still have a lot of work to do. But these numbers are important because these are the numbers that are going to be utilized when we talk about moving into phase 2 reopening, Governor DeSantis' step-by-step reopening plan. And they will use these numbers to determine what the virus is doing currently. They will also look at if the control measures that have been put in place are working. Can we relax some of those control measures, or do we actually need to make them more stringent because what we have in place is not working? It seems that what we have in place is working. While it's minimal and it's incrementally getting lower, we still have a long way to go. They're also concerned with contact tracing. At this point, contact tracing has been nearly impossible. Individuals that have tested positive, they are being questioned on who they've been around to try to determine the source, and they've either been around so many people or they've been so many different places that it is nearly impossible to determine who and where they may have gotten the virus from. Until our daily positivity rates drop below 5%, contact tracing is absolutely ineffective. While they continue to try to contact trace, especially more so with our vulnerable population, those individuals in nursing homes, those individuals that have maybe been self-quarantining or self-isolating a little bit better than others. It's a little easier to do. In a nursing home, you pretty much know who's come in and out, and it makes that job a little bit easier. One of the numbers we've also seen go down is the percentage of deaths per 1,000 COVID cases. While we used to hover at 5 to 6%, we are now down to 3%. So in essence, 3% of the individuals who contract COVID will die, which is down from 5 to 6%. So it was almost double at one point. We've got that number cut in half, but 3% is still unacceptable. We need to do better and work harder. We have been focusing very hard, as we have been from the beginning, on our vulnerable population. Fire Rescue's Prevention Division has an individual that's dedicated to monitoring our ALFs and senior centers. And I am happy to announce that all but one center in Riviera Beach have no positive cases. The one that does have positive cases right now is Edward J. Healy Rehab and Nursing Center, but that's to be expected as a rehab center, and it's not even the patients. They have employees that have tested positive but are asymptomatic. They have a regular regimen of testing to identify positives before they come into the facility, and they've identified 3 employees. But I'm happy to announce that Palms Edge, Heron Estates, Moore Assisted, Golden Years, Solomon's Care Services, Victoria Gardens, Sears Group, Villa Francescan, A Second Home, Wilson Small Group, Kindred, Memories Adult Daycare are all COVID-free. There's a lot of hard work that goes into making sure that that happens, and city administration and city council has blessed us with the abilities, the funding, and the staffing to be able to get that done, and that's a monumental achievement for our organization to have that many assisted living or senior centers with no active cases at this moment, considering the numbers that we're seeing. I want to talk a little bit about hospitals. As of right now, hospital bed usage rate, now this is overall, hospital bed usage rate is at 71%. And of that 71%, 8.8% are COVID-related patients. ICU bed utilization rate is at 77%, and 33% of those beds are COVID-related patients. Ventilator use right now is at 51%. Now, while those numbers seem like a lot, hospitals try to maintain a 25% bed availability rate for both overall hospital beds and ICUs, and they're just about at that number. We're seeing some very promising results from remdesivir, showing great patient recoveries after treatment with remdesivir. So that's really helped bring down some of these deaths. That's also helped bring down some of these long-term hospitalizations that we've been seeing. And again, that is good news. However, research is showing that workplace control measures and compliance are very effective. Individuals come to work, and not just in Riviera Beach, we're just talking about regular business. Individuals come to work, they're compliant with their mask usage, they have hand sanitizing stations all over their workplace, they're maintaining their social distancing. However, when they go home, these things tend to fall off. Normally, your home is your sanctuary. You feel comfortable. You tend to let your guard down. However, we have to continue to and make sure that we have CDC guidelines with us 24 hours a day, 7 days a week. We have to implement these all of the time. This virus isn't a Monday through Friday 9 to 5. It's a 24-hour, 7-day a week. So we have to integrate these guidelines that we seem to be doing very well following at work, because you have a supervisor over you making you do it. You need to be able to go home, and you need to have that same passion and that same energy when you're at home. whether you're going to a barbecue, whether you're having some people over, whether you're going out to the store. We need to make sure that we're adhering to CDC's guidance of social distancing, mask wearing, hand sanitizing, hand washing, so that we can eventually beat back this virus. I want to talk a little bit about some of the vaccine information that's coming out and some additional things that are coming out in relation to testing. There is a vaccine right now that has made it to the phase 2 process, which is a side-by-side test with a placebo. So basically, and that's actually happening here in the state of Florida, there is a laboratory that has reached phase 2. They are working to determine the effectiveness of the vaccine. So we are one step closer to seeing what may be a vaccine in the near future. The federal government has also stated that antibody testing will be added to state-run sites, especially in South County, Dade, Broward, and Palm Beach County. So we're going to see at Ballpark of the Palm Beaches and some of these bigger testing sites that have the resources from the state and the federal government, not only offering your PCR RNA testing, but we're also going to see the antibody testing to go with it. And this is going to help give us an understanding of where we're at as it relates to herd immunity. How many people have contracted the virus who may have been asymptomatic, who have antibodies, and it really just helps with the research and provide a better level of testing for everyone. COVID education compliance teams are out throughout Palm Beach County ensuring compliance. There have been multiple restaurants and facilities that have been shut down as a result of not complying with some of the requirements, such as bars being closed, making sure that individuals are social distancing, staying open past 11 o'clock, and they are being cited and fined. I am happy to say, good news, which normally I'm not the bearer of good news, but I am happy to say that we have seen a lot of businesses complying with the executive orders and the emergency orders that have been put out by the state and county. We are working with our local police department and code enforcement on ensuring compliance throughout the city, and we will continue to do that as long as we need to ensure that our businesses are in compliance to these orders. There has also been an emergency order 2192, an executive order 2192 that states Executive Order 2068 as extended by Executive Orders 2112, 2139, and 2166. You don't have to write all this down. Email me, I'll send it to you. The Department of Business and Professional Regulation shall ensure that all restaurants implement employee screening protocols pursuant to the guidance laid out by the CDC. So as we do with our employees, making sure that they are temperature screened, making sure that they don't have any symptoms associated with COVID, the Department of Business and Professional Regulation is now asking that restaurants, mandating that restaurants use the same type of screening for their employees before they come to your table, before they handle your food. I want to move on and talk a little bit about CARES Act funding. There has been a total of $85 million spent in Palm Beach County as it relates to CARES Act funding. There are $25 million has been used on what's been deemed government costs. Those are PPEs that have been put out throughout the county for each municipality and preventative measures. $2.6 million on food distribution, $1.5 million on housing assistance, another $1.5 million on countywide testing, $1.9 million on non-congregate sheltering, and $46.7 million on small businesses. As it relates to small businesses, over 5,000 applications have been submitted to Palm Beach County for assistance. 2,700 of those applications have been approved, and well over 150 are being reviewed at this time. The majority of the funds have been dispersed or distributed to businesses with less than 5 employees, so they truly are looking to help out those small businesses. Now, this is something that may be noteworthy, and we're going to work with our team to get this communication out. Palm Beach County has announced that they are going to be working with a their community services department, and launching a community health worker program. These are going to be jobs that are going to be available through Palm Beach County to help combat COVID-19. The program will have jobs that are going to be available for individuals to do public education, testing site assistance, contact tracing, information gathering and processing, and various other activities surrounding COVID-19. If you want more information on this, you can contact Sonia Holbrook, S-O-N-J-A, Holbrook, H-O-L-B-R-O-O-K, at 561-355-4700. Again, that's 355-4700. We know a lot of our community have either lost employment or is seeking employment, and that is a tremendous opportunity for individuals to be able to find some work during these challenging and difficult times. I want to finish off reminding everyone this is hurricane season. Hurricane Tropical Storm Isaias was a threat. It was a scare. There were little to no impacts specifically to our community. However, that should have been a warning for what is to come. NOAA, the National Oceanographic Atmospheric Administration, is predicting 19 to 25 named storms. That is the most ever that is being predicted on record. We've broken records on which storms have been named the fastest up to this point this year. So let's not get caught into falling into some complacency in that Hurricane Isaias turned into a tropical storm. I'm not worried about it. I'll wait till the last minute. Please look at where you may have fallen short in preparation for this storm. Gather those supplies and those things that you need so we can make sure that as a community we remain resilient throughout the rest of this hurricane season and are well prepared. That concludes my operational report. Ms. Noel, I turn it back over to you.
Thank you, Chief Curd. Next, we're going to hear from our logistics section chief, Ms. Pemsel.
Good evening, everyone. This is Althea Pemsel, the section chief. Good evening, Chair, Council, and the community. My report consists of the logistics of the supplies that we have on hand and the supplies that we're securing in the future. Currently, we have nearly 100,000 masks that's available for both the city and for the employees. We're consistently looking for sources so that we'll have primary and secondary sources for the future. As Chief Curd and Mr. Evans have said, the virus won't be going away for a while, so our goal is to ensure we have a continuity of supplies that's necessary for our operation and for our citizens as well. That being said, we are still sourcing sanitizer, masks, and other PPE that's necessary for us to continue to have a strong supply. We will continually also to buy supplies for the hurricane because we're doing dual duty as we also keep supplies for COVID-19. We also have to have supplies for the hurricane as well. So we're stocking both our water, Gatorade, and other debris removal supplies to be able to assist during that sort of storm as well. That concludes my logistics report. I turn it over to Ms. Noel. Thank you.
Thank you. Next, we're going to hear from our planning section chief, Mr. Bailey.
Yes, this is Terence Bailey, your planning section chief, and I'll keep it brief. The planning section has been working diligently with the executive team on updating the staffing model to the Alpha Bravo described by Mr. Evans, which will take effect on August 10th. The next significant staffing change we're anticipating is with the opening of school. We know that we have to make provision for this different model of education, and it will have some impacts on staff. Other than that, I would like to thank all in the community for all their excellent work over the weekend as we prepared for the hurricane. All of our requests from the executive team in the way of keeping roads clear so we could travel, clean up, bringing in garbage cans and debris were adhered to very significantly, which certainly allowed us to move resources to other efforts as we prepared for that storm. We ask that this be consistent in how we operate so that we can provide you the highest level of service during a storm. And that is your planning report, and I return it to you, Ms. Noel.
Thank you. Next, we'll hear from our Finance Section Chief, Mr. Sherman.
Good evening, everyone. This is Randy Sherman, City Finance Director and Finance Section Chief. I'm just going to give you a few updates on some of the items that we have addressed on prior calls. First, the Forgivable Loan Program. We have issued 13 checks. Again, if you know of anybody who would qualify for that program, we did have funding for up to 40 participants, and to date we've issued 13. Talked the last couple of weeks about the eviction moratorium. Again, the federal eviction moratorium did lapse. That was on July 25th. But the Florida mortgage foreclosure and eviction relief was actually extended. So the governor did extend it from August 1st to September 1st. So that was some good news in that regard. Quick update on our utilities. Again, as I've been talking about for the last couple of months, on Monday we returned back to our normal process that we use in the utility billing department. Good news, though. We actually had less than 10% of our overall accounts were delinquent on Monday. And so far, we have had about 90% contact with that 10%. So we are down, in essence, to about 1% of our customers that we have not been able to make contact with yet, and we are still making those efforts. Finally, I did want to again bring up the CARES Act rent and utility program that the county has. They actually have established a drive-through location in Riviera Beach. It's at 1440 Martin Luther King Boulevard. You do have to call and make an appointment, but we have one right here in Riviera Beach. There's no excuse. They've made it as easy as they possibly can for our residents. And again, this is utility assistance and it is rent assistance. I know Chief gave you a lot of numbers, but I'm going to give you one phone number. This is for, again, the Palm Beach County Community Services, and it is a 561-355-4792. Again, 355-4792. Ms. Noel, that concludes my report.
Thank you. Next, we're going to hear from our Health and Human Services Section Chief, Ms. Grimsley.
Yes, good evening, City Council and community. This is Valerie Grimsley, your YEP Director, acting as your Health and Human Services Section Chief. Health and Human Services continues to provide food distribution twice weekly on Tuesday and Friday at Wells Recreation from 9 to 11. We continually support the city manager's efforts in keeping our citizens safe through our mass up distribution plan. The following dates have been scheduled so that we will be able to continue to complement the community and citizens with this effort. We will be at Wells Recreation Center this Friday, August 7th from 4:30 to 6 o'clock. We will also be at Morrow Heights Park on Friday, August 14th from 4:30 to 6. Schultz Park on Friday, August 21st from 4:30 to 6. And Timber Pines, Friday, August 28th, 4:30 to 6 p.m. At this time, that is, we will conclude our mass distribution unless provided direction by Mr. Evans or the council to continue in various other parts of our city. Thank you, Ms. Noel. That concludes your Health and Human Services report.
Thank you, Ms. Grimsley. Next, we'll hear from our beach group leader, Ms. Aladia Franks.
Yes, good evening, Riviera Beach residents. Aladia Franks, Assistant Director of Parks and Rec, and Leisure Services Group Leader. As it relates to our municipal beach operations, we will be downsizing our beach monitoring teams throughout the week and the weekend. For your continued safety, we will continue to remain vigilant in making sure we enforce and remind our residents, our beachgoers, and visitors of the CDC guidelines as it relates to COVID-19. Mask up, social distancing, washing their hands, hand sanitizer, and also signage will be posted throughout to serve as friendly reminders. Our beach hours are Monday through Friday from 9 a.m. to 5 p.m. There will be on-site parking, and our beach restrooms will be available, cleaned, and sanitized throughout the day. Our awesome ocean rescue and our police officers will also be on site. And as Chief Kurt and City Manager stated, it's important that we continue to work together and do our part. That concludes my update, Ms. Noel. Thank you.
Thank you, Ms. Franks. Next is a communications report, which I will provide. And it's going to be pretty brief, but just 2 points. The first is that we have been growing our communications team. We've recently recruited Ms. Marian Dozier, who is now with us, serving as our senior multimedia communications specialist. And then soon we will be having Michael Hudson join us as well. He'll serve as our multimedia communications specialist. So they will be assisting Mr. Walter Stevens, who is our RBTV specialist and has been serving the city throughout the course of this pandemic. And so now that our team is being built up, you have about 60 years combined of print journalism, broadcast journalism, and live audio-visual production experience among the group. And we can foresee our ability to really serve the city in the area of communications. Is we understand that's of high demand for us. And then soon, the communications team will be implementing their electronic newsletter on a quarterly basis. And by doing so, they'll provide important information for the community to know, to include any upcoming events, anything regarding COVID-19, and maybe even other emergency situations as well. And so the community can look forward to that. If they want to be added to the listserv for that electronic newsletter, you can simply go to riverabeach.org, scroll to the very bottom of the webpage, and you simply have to provide us with your email where it says resident email list. And then there also will be a paper newsletter going out through mail as well, beginning in September, so the community can look out for that. That'll be done through utility billing. With that being said, that completes the communications report. And finally, we will hear a report from information technology, Mr. Parzielli.
Good evening, Ms. Noel. Last night we had a resolution to acquire. Yes?
Mr. Parzielli, I'm sorry. Yeah, but you're having an audio issue. There you go.
Okay, better. Sorry about that. Good evening. Yes. Thank you, Ms. Noel. Good evening, City Council, members of Riviera Beach. Last night we had a resolution to acquire some additional laptops. This is where PO went out today, and we're awaiting the manufacturer to confirm a delivery date on those. But it's going to allow us to deploy additional units for staff, kind of resolve some of the problem devices we have out there that are causing some issues. And the docking stations are going to allow those laptops that are deployed to staff to move and connect faster and safer between home and or their remote workplace and the Cube Farms or wherever they're going to connect when they get back to the city. I know one of the things that we've all been struggling with is getting bandwidth, especially when you're trying to work from home. And saw an article with lessons learned from the immediate use of tools like Teams and GoToMeeting and Zoom, Spark, and others that are out there about the placement of equipment and what interferes with wireless to make your experience better and that of everyone on the call. So number one was selecting the right location. The ideal placement is for your modem and wireless router in a central location and preferably on the first floor if you have a two-story dwelling. keeping it up high and away from windows, placing your wireless equipment on the floor. Your signal just goes straight into the ground. So for optimal performance, the recommendation is 5 to 7 feet high and away from windows. Avoiding interference, so keeping it away from your TV. I know mine's behind my TV. That's not a good spot for it. And other media components, so microwaves, metal objects such as mirrors and fluorescent lights tend to weaken your Wi-Fi signal. Believe it or not, keeping it away from aquariums, as water is not a good, it doesn't pass well for wireless signals through water. Restarting your equipment occasionally. A lot of problems can be cleared up by simply resetting or rebooting your router and modem on a regular basis. If possible, use a wired connection if you're streaming video between your modem via a wired Ethernet connection. And finally, understanding the bandwidth demands, as if others in your household, while you're trying to be on that meeting, are using video games, playing video games online, or video chatting wirelessly, this can slow the wireless signal for everyone in your home. So I just wanted to pass that along. I can put this, get a copy of this and put this out for everyone to see. So it may help with some of the wireless issues, especially in home networks. That concludes my report, Ms. Noel. Thank you.
Thank you. So that concludes our staff report. Now we will enter into any comments or remarks or questions from our elected officials. We'll begin with Dr. Votel.
Thank you, Marcia. Do we have any other elected officials besides Councilwoman Miller Anderson on the line? Did anyone else join us?
No. Well, actually, I just seen a hand raised, so just 1 second. You might just have someone.
Yes, Madam Chair, this is Douglas Lawson on the line.
Oh, thank you. Well, let's start with Councilwoman Miller Anderson, and then we'll go to Mr. Lawson.
Thank you, Chairwoman and staff. Just wanted to say again, as usual, I appreciate everyone that's working very hard during this pandemic, and as well as that hurricane that, well, didn't turn to a hurricane here, but it did make its way up the East Coast and do some damage. But we were spared, as Chief Kerr stated earlier, but I just appreciate everyone that rallied together and got the job done and kept everyone safe and communicated with everyone in terms of what we were doing here in the city. Also, I definitely appreciate Mr. Parzielli for providing those tips, and I certainly would like to see that in written format, because it definitely speaks to a lot of the issues that I've been recently having on my computer, trying to log in and connect with wireless on my computers. And so it's definitely a pull, I'm sure, because everyone is on their computer or on their phone or streaming or whatever. So that's very helpful information. And as usual, like I said, continue up the good work that everyone is doing, Mr. Evans, and especially your team. This has been such a long process in getting through this, but I think everyone, as the days go by, we're able to refine our responses, and I think we're doing an outstanding job. We mentioned last night during, I want to say our meeting last night, that Riviera Beach has been one of the first on many things that we've done in response to COVID, and I think that is a testament to everyone's hard work. And please know that everyone around the county are paying attention to it, and, you know, a lot of them are actually copying a lot of the things that we've done as a city. So I think, you know, I definitely want to thank my colleagues for being on the forefront of making sure that we provide the staff with the necessary tools and resources in order to do the job. So just thank you to my colleagues, and thank you to Ms. Evans, Chief Kurd, and all of the staff. Thank you.
Thank you. Mr. Lawson?
Thank you, Madam Chair. I just want to echo the same sentiments as Councilwoman Miller Anderson. I am just so impressed with the work that the staff has put in, the constant communication and the updates that they're giving to our residents and to my colleagues as well. So I just want to thank you guys for all the effort that you're putting in. I want to just let all the residents know that we're going to be hosting a community call tonight. It's going to be at 7:30, so immediately after this call, we're going to be doing a call that's called The Bridge, and it's going to have Chief Osgood. We'll have our State Attorney David Amberg, his staff, and then some of our local residents. So please, residents, if you want to tune in, you can watch on Channel 18, and you can also watch on YouTube and Facebook Live. So thank you again, staff. You guys are doing an amazing job. Mr. Evans, this is showed with the leadership that you're bringing, so thank you very much. Ms. Noel, you're running these meetings excellent, so thank you as well. Thanks, Madam Chair.
Thank you. I also want to say my thanks to everybody on the call. All the staff have been doing a great job. We really do a great job of communicating here in Riviera Beach, and that's all, I think, because of Mr. Evans' leadership, and we're so grateful for that and grateful for all of the work that all of our staff do. I think that's all I have for this evening. Thank you very much.
Thank you. If there are no further comments, was someone trying to speak?
No, this meeting is adjourned. Thank you.
All right, thank you.